Welcome back, everyone. Hope you enjoyed your lunch. I am going to revert back to public comment. We had one person in the queue that did not get to respond. So if DCA moderator would please open the public facility line, we have one person in the queue.
This is the moderator, and looks like we did have one comment popped in just as I was closing it previously. David Waldschmidt, I'm sending you a request to unmute. Dr. Waldschmidt, if you can hear us, I'm sending you a request to unmute your microphone for your comment from our last item.
Can you hear me?
We can.
Excellent. Great. Well, I will keep my comments brief. And I appreciate the opportunity to respond here. I'm responding really because there was a statement that was made that conflicts with a statement I had made when the Joint Commission presented in May. The standards for educational and psychological testing, which provide the relevant professional standards and testing and psychological in the testing and psychological measurement industry, the standards are very clear in indicating that testing agencies must provide evidence that examinations measure what they purport to measure. Performance-based measures should correlate with other measures of performance, particularly in licensure where the public health is at stake. In the presentation I delivered in May, I spoke to the correlations found in published research involving clinical licensure exams. Those studies correlated clinical licensure exams with faculty ratings of clinical competence, test case simulations for clinical disciplines, dental school GPA, grades in specific clinical courses, operative, fixed, removable PRAs, competency and restorative PRAs and perio, simulated patients, and that published peer-reviewed research showed very weak correlations between current clinical licensure exams and clinical performance. And in the presentation, I mentioned 0.05 was typical. The Dulosky, in contrast, correlated between 0.54 and 0.7. If the current clinical examinations were working and protecting the public, there should be a correlation there, particularly if, as described by the presenters, the examinations also involve decision-making and clinical judgment. A correlation of 0 corresponds to flipping a coin, whereas a correlation of 1.0 represents perfect prediction. A correlation of 0.05 is very close to 0. No one will ever be able to achieve 1.0, but certainly the Dulosky is much closer to that goal.
30 seconds.
And the presenters noted that the DSE OSCE is the most advanced computer-based OSCE in dentistry today. I would say that the Joint Commission feels that its Dulosky is the most advanced computer-based OSCE in dentistry today, and the numbers support the quality of our work. The Dulosky will provide California with the most effective solution in helping to inform the board's decisions as it works to protect the public. Thank you so much for this opportunity.
Thank you for your comment and thank you for your patience as we got in your public comment. And now we would like to move on to agenda item 24A, review of dental licensure and permit statistics. I'm going to ask Jessica Olney, manager of the anesthesia unit, to please report on this agenda item.
Thank you, President Pacheco, and good afternoon, members of the board. Agenda item 24A is the dental licensure and permit statistics. The items which begin on page 176 of 360 will start with the application breakdown for fiscal years 1819, 1920, and 2021. And this will display the license by reb, license by residency, license by credential, license by portfolio, and license by ADEX pathways. The application statistics are broken down by applications received, applications approved, dental licenses issued, applications that have been canceled, withdrawn, and denied by month. Beginning on page 180 of 360 are tables which display those same statistics, graphs, which display the same statistics of the applications. Again, that's applications received, dental applications approved, dental licenses that have been issued, canceled, withdrawn, or denied. These graphs are for the 2020-2021 fiscal year only. Page 183 of 360 gives us a breakdown of the dental license examination for law and ethics by pathway. Want to note that the last occupational analysis of this exam was done in 2018, and we anticipate the next occupational analysis to be completed in 2025. At the bottom of that page is a breakdown of the licenses that have been issued by pathway, and it's broken down for fiscal year 2018, 2019, 20, 18-19, 19-20, and 2021, with a total issued to date by pathway. Beginning on page 184 of 360 are the statistics for dental license and permits that are active, delinquent, canceled. Also for the dental license, it includes the reduced retired fee and disabled. And this is a breakdown for fiscal year of 2018-19, 2019-20, and 2020-21. And the last section of this agenda item is the breakdown of the population and dentists per county. That begins on page 186 of 360. And on page 188 of 360 is a table which shows the breakdown of the counties with the highest population per dentist, which reported is Yuba County, which has one dentist for every 11,269 residents. And the counties with the lowest population per dentist, which right now is San Francisco County, with one dentist for every 732 individuals. And does anyone have any questions regarding this agenda item?
Are there any board member comments? Seeing none. Are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. And seeing no requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. We will now move on to agenda item 24B, general anesthesia and conscious sedation permit evaluation statistics. I'm going to ask Ms. Olney to continue reporting on this agenda item.
Thank you, President Pacheco. This agenda item begins on page 189 of 360 in your meeting material. On page 190, we begin with our tables, which show the statistics for the general anesthesia evaluations, which have been administered in the 2020 to 2021 fiscal year. Just below that is a breakdown of the previous fiscal years to include fiscal years 18-19, 19-20, and again 2021. Also included in this agenda item, which is new, is graphs of each of those fiscal years, which begin on page 191 for the general anesthesia evaluation. And if we continue to page 192, we have the statistics for the conscious sedation evaluations for 2020, 2021, and then again just below that for fiscal years 18-19, 19-20, and 2021. Again, on page 193, we have graphs showing the evaluation statistics for conscious sedation evaluations. Continuing on to page 194 of 360 are the statistics for the medical general anesthesia evaluations for fiscal year 20 and 2021. Just below that again is the statistics for fiscal years 1819, 1920, and 2021. Continued on the next page with the graphs of those evaluations. On our final page, 196 of 360, we have a count of the evaluators who are appointed, broken down by general anesthesia, conscious sedation, and medical general anesthesia, and further broken down by Northern and Southern California regions. And this information is informational, no action is requested. And if anyone has any questions, I'd be happy to answer those.
Are there any board member comments? Please use the raise hand feature. And Dr. Felsenfeld.
Quick question. Are you having the general anesthesia evaluators do conscious sedations when you have trouble getting the conscious sedation evaluators?
Yes, we do on occasion. We always try to have at least one conscious sedation evaluator or conscious sedation permit holder in those cases. But our current regulations do state that the evaluator has to be familiar with the method of administration, does not specify that it has to be a similar permit holder. But obviously they do have to have a permit that allows them to administer that type of sedation or anesthesia.
Okay, thank you.
Any other board member comments? Seeing none, are there any public comments? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've again opened the Q&A panel. If you'd like to comment on this item, click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. Our first request comes from Dr. Bruce Witcher. Dr. Witcher, I've sent a request to unmute your microphone.
I always like to comment on this part of the board's meeting. It's nice to see that we've had an increase in general anesthesia conscious sedation evaluations since the low point in 2020 when we only did 114. Right now we're up to 147, which is definitely trending in the right direction. Just for point of reference, it's good to know that we need to complete a minimum of 165 GA evaluations, 80 conscious sedation evaluations, and 11 MGA evaluations per year in order for the program to remain current. I commented at previous meetings on the fact that we've had an uptick in permits issued to physician anesthesiologists, and I see that that has continued with 136 issued as of this meeting. The concern is there has not been a corresponding increase in the number of evaluations done for these permit holders. Generally, an on-site inspection is supposed to be done within 1 year of issuing a permit. However, it is very difficult to schedule the physician anesthesiologists because they usually work at multiple locations and they can only be evaluated by either a physician anesthesiologist or a double degree OMS. But it is good to see that we are sort of cleaning up the non-compliant permits. For the first time, I'm seeing a statistic indicating some permits are being canceled for non-compliance because the on-site's an important evaluation because physician anesthesiologists are often not familiar with providing anesthesia in the dental office environment. By undergoing the on-site, this verifies that they are prepared to provide anesthesia in this setting. So it's good to see things are heading in the right direction with the program here. I'd just like to see a little more activity and the MGA's understanding this is a challenging area. Thank you.
And not seeing any additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. We will now move on to agenda item 25A, 2021 tentative legislative calendar. I will ask board member Fran Burton, chair of the Legislative and Regulations Committee, to facilitate the agenda items regarding legislation.
Thank you, Madam Chair. I would ask you to first look at page 199, the tentative legislative calendar. And this is just some reminders of what you see there. The 27th is the last day for fiscal committees to meet and report out any bills with a fiscal impact. And then the week of the 30th is floor session only. September 3rd is the last day to amend any bill on the floor. And then September 10th is the last day for each house to pass bills. I wanted to particularly remind you of that because as we go into this discussion, we are in the waning days of this legislative session. And so where I invite comment on bills, this is not a time to invent the wheel on anything that we have not taken action on. So unless there are questions on that item, I'd like to move to item 25B, the update on pending legislation, and ask Karen Fisher, the executive officer, to present this agenda item.
I think we need to back up though and take any public comment on agenda item 25A.
Okay, are there any public comments?
Pardon me just a moment.
Ms. Jones?
She's asked for a minute. She's asked for a minute, Ms. Burton.
Okay.
My deepest apologies. All right, we have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. And seeing no comments, would you like me to close the panel?
Yes, please. Thank you.
It is closed.
Thank you, Ms. Burton. This is Karen Fisher, Executive Officer of the Dental Board, and I will be assisting Ms. Burton with the legislative report. There are 7 bills that were listed in your packet on page 202 that the board had previously discussed. And of those 7, 2 of them have dropped off the list essentially. AB 1552 relating to foreign dental schools died in committee. And it appears that SB 652 by Senator Bates will not be moving forward this session. So I'm going to start with AB 526, and that bill, the bill analysis is located on page 206 of your packet. Essentially, there's been, this bill is moving through the legislature. It was introduced on the Assembly side and now is in the Senate side. It is an urgency measure, And this is the bill that would allow dentists with the necessary training to administer the COVID-19 vaccinations and the influenza shots. This bill would also add dentists to the list of persons qualified to be a laboratory director for the purposes of the Federal Clinical Laboratory Improvement Amendments Program, which would authorize dentists to perform waived tests such as rapid point-of-care tests for COVID-19. The board has taken a support position, so it doesn't really need to, again, take a support position. So I'm not sure how you want to proceed, Ms. Burton. Did you just want to have, see if any board members had additional comment and then go to public comment? I would suggest we continue to support the bill, and should it go to the governor, to send a letter of support.
Again, if there are members who have comments on this, I would appreciate hearing it at this time, but there is no action required of us at this moment. And I see Steve Chan's hand.
Chairperson Burton, I'm very supportive of the legitimizing dentists as part of the distribution system of COVID vaccine. I happen to be in the mass vaccination team at my regional hospital. So there are many moving parts when it becomes a pandemic versus something like influenza. There's things of tracking the patients. There's elements of the rare side effects that can happen that could be life-threatening. So adding other pieces to the puzzle other than just having FDA approval might be considered. And I'm talking about maybe having somewhere where there's a provision where there's a nearby hospital if something were to happen. Thank you.
And Dr. Moreau has his hand raised.
Dr. Morrow?
Thank you. I'm very much in favor of this bill. When the pandemic first initiated itself, we found on my university campus that students in other healthcare professions, primarily pharmacy, medicine, nursing, and a couple of others, were able to administer vaccines at our community vaccination clinic on the site at the university. However, dental students were not until we were able to get a waiver. My understanding is that this bill, if passed, would result in administering vaccinations as a scope of practice for dentists in the state of California, which would then enable in future pandemics or urgent situations would allow us to provide dental students to provide those vaccinations. We had, unfortunately, 400 dental students on our campus that were not able to assist in the vaccination clinic.
Are there other board member comments? Dr. Loren? Dr. Loren, did you have your hand up?
Oh, so forgot to unmute. Thank you very much. Yes, I was just saying that I think the part of the being able to do COVID testing is extremely important, especially now that healthcare workers have to either be vaccinated or have to show proof of getting COVID testing. So that's going to be a chore also for dentists going out there and having to test everybody, because I know I have 2 of my employees did not want to get the vaccine. They both had COVID. And just a way of trying to push them to get that vaccine. But we have to make sure they get the COVID testing, and that would make it very accessible. So I do support both of these issues, the COVID testing and the vaccine vaccination of the flu vaccine and the COVID vaccination. Thank you.
Thank you. Any other board member comments? Any public comments? And I will ask the moderator to facilitate the lines for public comment, please.
This is the moderator. We've opened the Q&A panel. If you'd like to make a comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. And seeing no comments, would you like me to close the panel?
Yes, please.
It is closed.
Member Burton, are we ready to go on to AB 885?
Yes, we are.
Okay. Members, the board voted to support AB 885. Unfortunately, this bill never got out of the House of Origin. It was related to the Bagley-Keene Open Meeting Act and would have extended the board's ability to have WebEx meetings like we currently have. Currently, there is no other bill out there right now to allow this format to continue at this time.
Thank you. Any board member comment? Seeing none, any public comment? And moderator, please facilitate the line.
This is the moderator. I've opened the Q&A panel. If you'd like to make a comment on this item, please click on the Q&A icon on your screen, type comment into the text box, and submit that to the host. Our first comment comes from Dr. Bruce Witcher. Dr. Witcher, I've sent you a request to unmute your microphone.
Yes, just a comment. Even though this bill didn't pass, I believe it would still be possible for the board to meet by WebEx as long as they notice the location of all participants. I know we've met in the past by a teleconference by doing this, and I think there's an advantage to having this option available. Of course, I think we'd all like to get back to live meetings, but still, the obstacles of travel and distance are really significant. And I think we get greater public participation using internet-based format. So I'd like to see both options explored. Thank you.
And seeing no additional requests, would you like me to close the panel?
Yes, thank you.
It is closed.
Okay, just to notify the board, AB 1552 is relating to foreign dental schools, and that died in committee. So I believe, Chairman Burton, we probably don't need to take board member comment or public comment on this item.
I don't believe so. Although I do see Dr. Molina's hand.
Okay.
Last time we you informed us that it didn't go through committee, but I still would like to discuss it. I feel very strongly that this subject is very important for our community. And even though it didn't pass, it might be something that we can consider in the future. These two schools were accredited by the board, and they are just asking for an extension in terms of having enough time to go through quota. So I think that is something that is not too unreasonable to be asking. So if maybe we need to have the schools give a presentation, just like we did REB give us a presentation, or more clarification on the point?
We're actually going to have some discussion of an amendment on that bill at a later point. But again, this bill is dead.
Yes, and I'm aware of that, but I still think that we need to consider how to handle the whole quota issue, because even the next bill is really not enough time for them to go through quota. But we'll discuss it then. Thank you.
Any other board member comment? Any public comment? Moderator, if you would facilitate the line, please.
This is the moderator. We've again opened the Q&A panel. If you'd like to comment on this bill, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. And seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
Okay, Ms. Fisher, this brings us to SB 534.
Thank you, Ms. Burton. Direct board members to page 213 of the analysis for SB 534. This is a dental hygiene bill. This is working its way through the process. I believe right now it may still be in suspense in the Assembly Appropriations Committee, but that's changing every day. So we do have a support position on this bill, and so the board has supported this bill in the past. I would recommend continued support.
Okay, that does not call for a motion, but I will take board member comment if there is any. Seeing none, any public comment? And I'm going to ask the moderator to facilitate the lines for this, please.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this item, please use that Q&A icon on your screen, type comment into the text field, and submit that to the host. Our first comment comes from Francisco Leal. Francisco, I've sent a request for you to unmute your microphone, and a reminder you will have 2 minutes. You should see a pop-up at your end with an unmute me button that you can click on. We can hear you.
Thank you. My apologies. I was trying to get in to make a comment on AB 1552, and I just want to make a quick statement on that bill. It is on your agenda, and I'm going to just provide something for your benefit. Again, my name is Francisco Leal. I represent the University of Moldova, one of 2 foreign dental schools approved by this board. The other is La Salle in Guanajuato. AB 1552 was sponsored by Moldova to address a problem created by prior legislation that requires Moldova to be accredited through quota by January 1, 2024, or it would lose its status. That legislation is AB 1519, which this board supported. At a previous board meeting, I conveyed to you folks that this deadline does not afford Moldova sufficient time to do the quota process. I've sent Ms. Fisher and your board quota documents that clearly show that the quota accreditation process takes 8 to 10 years. In fact, La Salle went through quota, started in 2007, and in 2019, it was denied accreditation. That's why Member Garcia authored AB 1552, which would extend Moldova and La Salle's approval to 2030, so they can remain approved and go through the quota accreditation process. I've requested written confirmation from this board that shows that Moldova can indeed complete quota by the imposed January 2024 deadline. None has been provided. I'm asking you this question. What is the timeframe for a foreign dental school to complete the code accreditation process? And if it is indeed 8 to 10 years, why is this board not supporting legislation for an extension so that your only 2 foreign dental schools remain approved?
30
Your
seconds.
support of AB 115 or 1519 with the unrealistic January 2024 deadline, in essence, is an action to eliminate the California Foreign Dental School Program, a program intended to address the shortage and maldistribution of dentists in the state that has yielded many competent dentists, mostly of minority backgrounds, who are providing dental care to unserved communities. And it is disappointing to me that this board is not only unwilling to support this program, but actually has taken actions to eliminate it. These are issues of equity, dental care access that, as expected, have significant adverse impacts on poor communities. This board needs to reassess, re-examine its decisions vis-a-vis Moldova and La Salle. Thank you.
Thank you. And our next comment comes from Anthony Lum. Anthony, I've sent you a request to unmute your microphone.
Can you hear me okay?
We can.
Okay, perfect. This is Anthony Lum, Executive Officer of the Dental Hygiene Board. Excuse me. Just want to say thank you and appreciate your support for our bill SB 534, and it'll help us to continue to do our good work in consumer protection. So appreciate all the support that the board gives us. And thank you very much.
And seeing no additional requests, would you like me to close the panel?
Yes, please.
It is closed.
Now move on to SB 607. This is an omnibus bill that covers a lot of different changes for a lot of different boards, but it started out primarily as the board's bill to eliminate the RDEF clinical and practical examinations. The analysis of this bill is found on page 214. Essentially, it is going through the process, but I want to draw your attention to the 2 amendments that were made around July 13th, and if you'll go to page 293 in your packet, you'll be able to actually see the language. So what was included in this bill essentially is an amendment to allow the Université de La Salle to continue to be board approved until June 30th of 2026. If you'll recall, De La Salle had been approved by the board for many years and had gone through many renewal processes and actually had completed its last renewal process with the board in May of 2019 prior to the Sunset Review bill being signed, and the board had approved them for an additional 7 years. So they went to the legislature and asked that since they had already had their review and the board had agreed that their renewal was good for an additional 7 years, they requested board approval to remain through June 30th of 2026. Also on that section, you'll see that they've added a section to Business and Professions Code to accommodate the Moldova school. In this section, it allows the board, the Moldova school, to remain approved until the class of 2019 graduates. There's no end date on this, but it does allow the class of 2019 to graduate. Now, just as a point of reference, Moldova should not have taken in the class of 2019 because they were advised in 2018 that when their board approval would expire, which was December 31st of 2023. I would recommend the board continue to support this bill. That concludes my remarks.
Okay. So I'm going to suggest an motion on this, and the motion is to accept the July 23rd, 2021 amendments. And I am going to move this item and ask for a second. Is there a second?
This is Tara Welch. Can I get some clarification on the motion? Are you moving to support the July 23, 2021 amendments? I think you said accept.
Well, I said support, but if I said accept, that's not what I meant.
And it's July
So the
13th.
motion-
I'm sorry. It's the amendments of July 13th.
So that's a motion. Is there a second?
Second.
I don't know whose hand was first. I'm going to,
Ms. Pacheco said she seconded.
okay. So the motion has been moved and seconded. Are there any board member comments? Any public comments?
Open the Q&A panel. If you'd like to comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. Our first comment comes from Alejandra. I've sent you a request to unmute your microphone.
My name is Dr. Alejandra Galindo Magallanes, and I am in support of SB 607. I have a son, Christian Magallanes, who was admitted into the dental program at Moldova State University in 2019 and is now going into his third year and receiving an excellent dental education. I also have a daughter, Bianca Magallanes, who graduated from the University de La Salle del Bajío in León, Guanajuato, Mexico in 2017 and successfully passed her dental boards in 2018 and is now practicing in San Bernardino County. I also have a nonprofit named Healthy Teeth for Kids, where we work inside the San Bernardino City Unified School District that has one of the largest poverty levels in the nation, where we provide dental services to every child that turns in a consent form, regardless of their insurance status. My son, who is studying in Moldova, would like to follow in my footsteps, providing services to the children of San Bernardino if he is given the opportunity to graduate from Moldova. We will be soon having a greater shortage of dentists to work in the underserved areas with all of the baby boomers retiring. And I would like to know why the dental board wants to make it harder or get rid of the foreign dental schools, which cost much less to attend, keeps our dental students out of massive dental student debt, and also addresses the great future shortage of dentists. I would greatly encourage the dental board to keep these programs available for future dental students. Thank you.
Thank you. And our next comment comes from Christian. Christian, I've sent you a request to unmute your microphone.
I hope you guys can hear me. My name is Christian Magallanes. I'm a third year dental student over at Nicola Testamatiano, University of Medicine and Pharmacy. The quality of education that I am receiving there at that university is of the utmost excellence. Like, I couldn't have actually asked for a better opportunity for what the school has been offering me. I'm given patience to be able to practice on being able to learn a different language while I'm there. I'm able to actually just enjoy the opportunities, and as well as pursue my passions as pursue my passion for my future as a dentist later on, and just follow my parents' footsteps. I'm very appreciative of the Dental Board of California to give this opportunity for me to speak on my behalf of this, because I would like other dental students in California to be able to follow in my footsteps as well, and be able to give them that opportunity, and have money not be an option on that case. I know there's a lot of other students out there that, they take on $500,000 in debt, and they don't know what to do then. And for me, I'm given an opportunity to go to a school that's about a quarter of the cost that a university would be here just to go. Thank you.
Thank you. And our next comment comes from Francisco Leo. Francisco, I've sent you a request to unmute your microphone.
Am I in?
You are.
Thank you, board and staff. Again, Francisco Leal, I already introduced myself. I had something written, but I do have a comment regarding the comment made about Moldova not taking in students. So Moldova was approved by this board in 2016 for a 7-year period. So are you saying that they're only allowed to have 2 classes? There'll be the class of 17 and 18, but they can't bring 2019 because they graduate after their accreditation. The expectation is that you would work with Moldova so that you can continue the program and not put a stop to their intake of classes. So I don't accept that premise. I do want to convey to you that this SB 607 corrects a huge problem that was created by 1519 with the imposition of the January 2024 deadline without taking into account students that were already enrolled even before these provisions were in ink. And Dr. Laden, I did my research, actually expressed concern at your meeting of August 2019, where she said, if I can quote her, quote, was concerned with students who are currently enrolled in school when the bill takes effect in January 2020. And this quote, Ms. Fisher responded that those students who are currently enrolled in the program will graduate. Well, that was not the case. These students are going to graduate in June of 2024. As a consequence, they had anxiety, they had a bunch of issues to deal with, and they had to hire us and other lobbyists to rectify a problem that was created by this board. And so we're very happy with the legislation. We did meet with the senator. We were able to get it through. The students are protected, but it ignores the bigger problem. How are you going to allow these schools to just not be in operation while they go through a quota process that is so difficult, and who knows what will come out of it?
30 seconds.
So again, it is unfortunate that parents have to expend resources to correct the problem. The larger problem really is that you have a deadline of 2024, and the elimination of the foreign dental school program. If you look at La Salle, it's been a success, infusing approximately 300 dentists over time. So that's my statement. Thank you.
And our next comment comes from Gerardo Zelaya. I've sent you a request to unmute your microphone.
Everybody hear me?
We can hear you.
Okay, perfect. So my name is Gerardo Zelaya. I'm also a student enrolled at Nicolai Testimizano. I'm 26 years old. I'm the son of 2 dentists, one of which my mother, who practices in California. As a side note, she's also a graduate of De La Salle and their 2-year international program. Also, clearly passed her boards as well, first time. I was and am very excited about the opportunity that was given to us by the dental board. So you guys, thank you, to pursue a career in dentistry through the Moldova State University, Nicolai Testimizano. I personally am and always have been very passionate about dentistry and about helping others. So much so that even in college, when I studied business and communication, I still volunteered at 3 CDAs whenever I could. Anyway, as you can all imagine, I was very concerned for my future when I heard that our accreditation was ending 6 months before our expected graduation date. I had chosen this school because it had the approval of the dental board, and therefore my full approval and my full confidence. I had never expected and never thought that something like this could or would happen. Um, yeah, and I believe that myself and my colleagues have a lot to offer to our state and to our respective communities. I know that we will come back ready and prepared to serve others through the
30 seconds.
education that our university is providing to us. Okay. Uh, I know most of us have grown up around underprivileged areas, like my own in the Central Valley. And speaking for myself, I look forward to the opportunity to represent the state, this dental board, and the profession as a whole in the most positive way that I can. I hope that you can reconsider the endorsement of this legislation that will terminate our university's accreditation. Thank you.
Thank you. And our next comment comes from Raj. Raj Gautam. I've sent you a request to unmute your microphone.
Assuming you can hear me?
We can.
Thank you very much. My name is Raj Gautam. First of all, thank you very much to the board for taking the time to hear us out. I'm a proud parent of a student. She's currently enrolled in the Moldova Foreign Dental Program. Obviously, we signed up for this program. We've heard a lot of good things, and the fact that it was accredited by the dental board for us to enroll. She's been enrolled in the program since the spring of 2019 and is scheduled to graduate from June of 2024, as most of the students and the parents involved in this group. So, however, without us getting notified 2 years ago, after she's worked almost a year and a half, this board supported legislation AB 1519 that would terminate the accreditation of Moldova in January 1st of 2024, 6 months before my child's graduation. Since then, we had to hire lawyers, lobbyists to correct this problem, again, directly impacting my child and that batch itself, a number of other students. We were never informed that this board intended to terminate this program. I can imagine, you can imagine that the stress and anxiety that caused in our children, not knowing if they will be able to graduate from a California accredited foreign school, as well as be able to practice dentistry, which is, of course, their lifelong dream at this point in time. So we're told that SB 607 addresses our concerns, and now our children will be able to take the California exams in the summer of 2024. And so I urge you to support SB 607, but I also want to tell you that Moldova dental education is excellent, and we have a shortage of dentists in this state, particularly in low-income communities. I definitely have to question why this board would not support Moldova and actually endorse the law that would terminate the school's accreditation. So thank you very much for your time, and thank you for supporting SB 607 for our child's futures. Thank you.
Thank you. And seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Okay. We have a motion and a second. And I am going to ask, and I should have added to that we send a letter of support to the author for those July 23rd, 2021 amendments. And I don't think I said that earlier. And I'd like to have the board secretary call a roll, please.
Secretary Alan Felsenfeld, and the motion is to support continued support of SB 607 with the July 13th amendments and sending a letter of support to the author. I'll now call the roll. Burton.
Burton, aye.
Burton, aye. Chan.
Chan, aye.
Chan, aye. Felsenfeld, aye. Lareen. Lareen, aye. McKenzie.
McKenzie, yes.
McKenzie, aye. Medina.
Medina, aye.
Medina, aye. Mendoza. Mendoza, aye. Molina. Dr. Molina? Molina, aye. Montel.
Montel, aye.
Montel, aye. Morrow.
Morrow, aye.
Morrow, aye. Olagi. Olagi, aye. Pacheco.
Pacheco, aye.
Pacheco, aye. Stewart.
Aye.
Stewart, aye. You. Dr. Yu? Looks at Dr. Yu is, oh, there he is. Dr. Yu.
Dr. Yu, you are muted.
Dr. Yu, can you hear us? I will say Dr. Yu is absent at this point. The motion is still unanimous. The motion is adopted. The vote is still unanimous, excuse me, and the motion is adopted.
Okay, thank you. The next bill is SB 772.
Thank you, Ms. Burton. SB 772, the analysis is found on page 217. This bill is moving through the process. I'm sorry, it's not moving through the process, and I don't think it's going anywhere this year. So we don't need to, we did have an opposition to this bill, and it doesn't look like it's going anywhere this year. So, Ms. Burton, if you want to continue to ask for board input, I don't think it's necessary at this time, but if there are any additional board members that would like to comment.
I feel that I'm obligated to ask, are there any board member comments? Seeing none, are there any public comments? Moderator.
This is the moderator.
Yes.
We've opened the Q&A panel. If anyone would like to comment on this bill, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. And seeing no requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. That concludes the discussion on the 5 to 7 bills that the board had taken positions on. The additional 9 bills that appear on page 203 of your board meeting packet, the board has continued to watch. No board members had indicated that they wanted to pull these out for a specific discussion. So I'll hand it back over to Ms. Burton.
Okay, unless there are board members who want to discuss AB 2, AB 29, AB 107, AB 646, AB 1026, AB 1236, AB 1273, AB 1386 or SB 731. If anyone wants to discuss, if you would use your raised hand, please. Are there any public comments on any of those bills? And moderator, if you would please facilitate that item.
This is the moderator. If you'd like, I've opened the Q&A panel. If you'd like to make a comment on those bills mentioned, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. Our first comment comes from Dr. Bruce Witcher. Dr. Witcher, I've sent the request to unmute your microphone.
Comment on SB 652. The author may make that into a 2-year bill, so you may be seeing it again. That's all that I have to say. Thank you.
Thank you for sharing.
And not seeing any other requests. Would you like me to close the panel?
Yes, please.
It is closed.
Okay, the next item is agenda item 25C. And that is on page 349 of the agenda. This is an item that we added some years ago to give stakeholders an opportunity to submit proposals in writing to the board before or during the meeting for possible consideration by the board at future board meetings. Is there any board member comment? Any public comment?
This is the moderator. We've opened the Q&A panel again. If you'd like to make a comment or a proposal on a prospective legislative proposal, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. And not seeing any requests, would you like me to close the panel?
Yes, please. Thank you.
It is closed.
And President Pacheco, I will give item 26A back to you.
We will now move on to agenda item 26A, update on pending regulatory packages. I will ask Ms. Wallace to present this agenda item.
Good afternoon. The Dental Board has initiated several regulatory packages, and board staff are actively working with the DCA Board Regulatory Legal Counsel, which is separate from our Board Legal Counsel, to review the proposed language that was approved by the board and develop the initial rulemaking documents and work through the rulemaking process. In your board meeting packets, we've provided a chart providing a brief overview of the status of each package. I'm happy to report that the Diversion Evaluation Committee membership rulemaking package was finally approved by the Office of Administrative Law that adjusted the membership requirements and ended term limits in order for us to maintain adequate coverage in our diversion evaluation committees. That package was approved and filed with the Secretary of State office on July 13th and will become effective on October 1st. The dentistry law and ethics examination rulemaking relating to updating the passing score requirements to come into compliance with Business and Professions Code Section 139 is in progress of having the final rulemaking put together to be submitted to OAL. And the remaining packages relating to continuing education, telehealth notifications, dental assisting, radiographic decision-making, and ITR elective facial cosmetic surgery, permit application and renewal requirements, mobile and portable dental units, the minimum standards for infection control, and the SB 501 anesthesia and sedation requirements are still being worked on as we work back and forth with DCA Reg Council. I'd be happy to answer any questions you might have.
Are there any board member comments? Please use the raised hand feature. Seeing none, are there any public comments? DCA moderator, please facilitate the lines for public comment.
President Pacheco, my hand's getting tired by holding it up and you not recognizing me.
Okay, I have to scroll down here. Let's see.
Thank you.
Your hand wasn't showing up.
Yeah.
Oh, okay. All right.
It's showing up on my screen.
Well, we're
click on it.
On Dr. Stewart.
Thank you. And Sarah, just a quick question. In terms of the CE requirements, telehealth, dental assisting, all the rest, would you give us just kind of a timeline in terms of how that, what's the timeline and how the rest of this work might pan out? How much time are we talking about?
Stuart, that's a great question, and I wish I could provide you with a more definitive answer. On all of those packages, we continue to work with DCA Reg Council to finalize the text and answer questions and provide additional specifics. And until the Reg Council essentially signs off on it being ready to move on, I'm not able to give a time frame. Once they say it's ready to go, then typically it's another 3 to 6 months before we can file with OAL for publication. And then once it's published with OAL, it's typically another year, usually 9 to 12 months after that, before the rulemaking is approved by OAL and filed with Secretary of State. Once it's filed with Secretary of State, depending on how important the rulemaking is, it may become effective on a quarterly date, or it may become effective upon filing with Secretary of State, depending on the justification that we submit with the rulemaking. So at this point, we're at least 18 months out, I'd say, for all of these packages. Obviously, the SB 501 and the continuing education rulemaking that the board initiated in May that are required to become effective in January are our utmost priority, and we're working diligently to try to get this ball rolling with the hopes that those will become effective in January on an expedited basis.
Thank you, Sarah. That was very helpful. Thank you.
Thank you, Dr. Stewart, and we certainly did not mean to ignore your raised hand there. Are there any other board comments? Are there any public comments? We will go ahead with the facilitating the lines for public comment.
Okay, we have the Q&A panel still open, and our first comment is coming from Dr. Bruce Witcher. Dr. Witcher, I've sent the request to unmute your microphone.
Comment on the SB 501 regs. Earlier, a couple of board members had comments about what happens when a permit holder is denied a permit. And as it presently stands, they can reapply and be issued a new permit. This is for general anesthesia, conscious sedation, I'm sorry. They can apply and be reissued a new permit, permitting that they complete a on-site inspection and evaluation. The SB 501 regs still have a way to go, but there is a provision in there that would give the board the option of requiring remedial education prior to issuing that permit. And this was designed to keep applicants from just revolving around and applying for a new permit when they perhaps need a little bit more remediation before they're ready for that examination. It's not to deny them the possibility of getting a permit, just to make sure they're really qualified. So thank you.
Thank you, and not seeing any other requests. Would you like me to close the panel?
Yes, please.
It is closed.
Thank you. We will now move on to agenda item 27, discussion and possible action regarding 2022 meeting dates. I will ask Ms. Fisher to present this agenda item.
Thank you, Ms. Pacheco. I think probably the easiest way to move forward with determining the dates is to start with the first box on the upper left of the chart and just ask board members to let me know what dates they are not available for. So you're looking at February 10, 11, February 17, 18, February 3, 4.
Mackenzie has her hand raised.
Go ahead, Meredith.
So the 18th may have an issue depending on where the location is.
Okay. So the next question will be, do any of the board members have a preference of the 3 dates? Aside from Meredith not sure, maybe the board should be focusing on either February 10, 11 or March 3, 4.
This is President Pacheco. February 17, 18 falls on the President's Day holiday.
Okay. Dr. Chan?
February 11th, will we have dragon dances and lion dances and fireworks because it's Chinese New Year's?
Only if you coordinate that. So does that mean people are leaning toward March 3, 4? Going once? Going twice?
Hold on, Felsenfeld, you didn't say me. I don't like March 3, 4. I have a commitment to be somewhere through the day. You can hear me, right?
Yep.
It's okay. I have a commitment to be there through the day. If we do the 11th of February, I promise you I will still not sing.
Dr. Lorraine?
Yeah, I like the weekend of the Anaheim CDA presents. I can go to either one, in any of these, but it's just really nice because we can go to the convention after that. I don't see that being a problem with the holiday or weekend. I don't.
Isn't it?
Yeah, that's the May meeting.
Anaheim CDA presents is on February 17th, it says.
No, that's the May 12, 13. It's 4 boxes.
It says proposed dates for 2022, February. Which is that? Oh, May. Oh, yeah, okay, I get it. Okay, it's a different. Okay, I get it. I thought I was across the line. Okay, no, that's fine. Any day is fine for me. Thank you.
Okay, so it looks like Ms. McKenzie may have a conflict on February 17, 18. Dr. Felsenfeld may have a conflict on March 3, 4. So far, other than the Chinese New Year celebration, are we okay with February 10, 11?
This is Steve.
Okay.
Yeah,
All right,
as long as we don't have to watch. As long as we don't have to watch Dr. Chan's dance and sing. Okay.
Okay.
I think
that's
the first day of Chinese New Year is February 1st.
Right.
So that would be to go to the end of the New Year already, should be okay.
Yeah.
Okay.
So
Okay.
Steve Morrow, just beware of the fireworks.
Okay,
yeah,
so it looks
I
like
know, Steve, you're just fireworks waiting to happen anytime. So.
Okay, so it looks like February 10, 11 will be the first meeting of the new year. We can hope that it's going to be in person, but we will just stay ready to pivot, however, and that's going to. So the second board meeting, typically the board has scheduled this meeting around the CDA Presents in May. And so we're looking at actually May 12th and 13th. Typically, the board does Wednesday, Thursday, but we have not seen an increase in participation. So from other public members who we thought we would attract to come to our board meeting. So staff this time is recommending the board go back to its Thursday, Friday meeting. That would be May 12th, 13th. And if there are conflicts, the additional date is May 19, 20. I'm sorry. Okay, so I'm not sure who had their hand up first. Ms. McKenzie, why don't you go ahead, and then Dr. Loren?
Conflict on the 20th.
Okay. And Dr. Loren, you were supporting the May 11, 12 date?
I was only going to, I can go to any of these meetings. I'm fine with them.
Okay, so is the rest of the board okay with May 12, 13?
Yes.
Okay, that's looking good. We're on a roll. Okay, the summer board meeting, we've got August 18, 19 or August 25, 26. Are there any board members that have any conflicts on those two times? Ms. McKenzie?
Yeah, of course, it's always me. So I might have an issue on the 18th, and there's also a possible on the 26th. So for me, it's a little bit of a wash. I would, but the 18th, 19th is probably a little bit less likely I'll have an issue.
Dr. Montel?
18th and 19th, I wouldn't be able to make that date.
Okay, looks like we're moving on to August 25, 26. Going once, going twice. Okay, August 25, 26. Last meeting of the new year, 2022, is either November 3rd and 4th or November 17th and 18th. Do any board members have conflicts?
I prefer the 3rd and the 4th.
I'm sorry?
You said 3rd and 4th?
Uh-huh.
Versus 17 and 18?
Uh-huh.
Okay, 3rd and 4th works better for me.
Ms. McKenzie?
Yeah, I have a conflict on the 4th, but I might be able to resolve it if that's the preferred day.
Okay. All right, board members, so it's looking like it may be November 17, 18. So we'll put the schedule together. Just also giving you a heads up, please mark your calendars for Friday, October 7th. Next year will be the year the board staff will be putting together the background information for the Sunset Review Report that will be due to the legislature by December 1st. And so throughout the year and at your meetings, you're going to be making policy decisions, and staff are going to be essentially melding all this into a big report. This is the opportunity for the board to put in writing to the legislator their asks to clarify statute or other policy issues. So staff will be working diligently to have a draft report ready by October 7th. So this will be a special one-day meeting of the board to essentially approve the report so that it can be submitted by December 1st. I know that the meeting is scheduled for November 17th and 18th, and if there are any little last-minute things that might need to be done, that could be the last time, essentially. But if the report will be due on December 1st, we actually send it to someplace to be published. And so we need time to do that. And I don't think having our board meeting 17 and 18 is going to allow that publishing of the report. So that's why staff will be asking for the report to be approved earlier. So just hold that date on your calendar and we'll keep you posted. So I don't believe we need to vote on any of those dates. We'll go ahead and send those out next week so that you can make sure to mark your new calendars. And thank you all for coming prepared and being able to respond to your availability. That concludes this agenda item.
It's in November 3rd and 4th, is that right?
No, I think it was November 17, 18.
Okay, good. Okay, thank you.
So I'll repeat. So the first meeting will be February 10, 11. The second meeting will be May 12, 13. The third meeting will be August 25, 26. We'll have a special one-day meeting on October 7th. And then the final meeting of 2022 will be November 17th and 18th.
Thank you.
Just as an additional reminder, we do have to have special meetings now and then if a proposed decision falls, sort of at an awkward time. The board voting on proposed decisions, when we send those out, if you ask for it to be held, we have to make sure that the board makes a decision within 100 days. So there may be additional meetings sort of stuck into next year, but we always try to, try to accommodate board members, try to do it quickly over the lunch hour. And so staff is trying to make sure that that doesn't happen very often, but it does happen on occasion. So that concludes this agenda item.
Do we need to ask for public comment?
Yes.
Okay, DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've opened the Q&A panel. If you'd like to comment on this item, please click on that Q&A icon on your screen, type comment into the text field, and submit that to the panelist. I'm sorry, to the host. And seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. We will now move on to agenda item 28, future agenda items. Do any board members have any items for a future agenda? I do not see any raised hands. Do any stakeholders or members of the public have any items for a future agenda? DCA moderator, please facilitate the lines for public comment.
This is the moderator. We've again opened the lines. The Q&A panel is open. If you'd like to comment, please click on the Q&A icon on your screen, type comment into the text field, and submit that to the host. And seeing no requests, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. Moderator and board staff, thank you for your assistance with the meeting today. That concludes the August 19, 2021 quarterly dental board meeting. This meeting is officially adjourned. Be safe and please think about the firefighters out there keeping us safe. Have a good weekend, everybody.
Bye, everybody.
Thanks,
Bye.
everyone. Bye-bye.
Bye.
Bye-bye.